And Ontario Health Minister Sylvia Jones is a signatory to that letter. She's with us live now. Hi, Minister. Good to see you. Thanks for making the time.
Not at all. Pleasure to be here, Vassy.
Why a quote-unquote indefinite pause?
Well, I want our focus to be on treatment. I want our focus to be able to provide services for individuals who are suffering from mental health illnesses. You know, we've made a very strategic investment here in Ontario, and I know other Canadian jurisdictions have as well, to focus on expanding treatment bed, to focus on making sure our youth have access to services. That's where I want the investments and the focus from our clinicians and from our governments. And frankly, it is exactly what we are hearing from organizations like CAMH here in Ontario.
So I have a number of questions about your government's efforts, or perhaps some might characterize them as lack thereof, when it comes to expanding access to mental health care. But do I interpret from your comments that your government is opposed to the expansion of MAID, period, final stop?
Our focus as an Ontario government is to expand access to services. I do not want the only option to be individuals who have to apply for MAID. We've expanded our mental health treatment beds by over 400 since 2019. We have now 22 youth wellness hubs in the province of Ontario that we didn't have 5 years ago. We are making very strategic investments to make sure that people have options, and those options include pathways to treatment.
Again, though, do I interpret from those comments that you do not anticipate a time where the Ontario government will provide the option of MAID to people who are suffering from mental illness?
Listen, the federal government obviously has control over the MAID and MAID expansion. It is my hope that we can transfer and focus on treatments and not just talk about whether we are ready to expand medical assistance in dying. I really, truly want us to be talking about treatment options and expanding treatment options, and not only and exclusively about medical assistance in dying.
Who is only or exclusively talking about medical assistance in dying? I wonder, Minister, if two things can be true at once, that there be a focus and a conversation, as you rightly point out, on expanding access to mental health services at the same time as Senator Pamela Wallin, for example, wrote in a dissenting opinion on the committee report that was tabled earlier this week. This is genuinely a matter of life and death. The government should not renege on its promise to respect an individual's right to choose. The people who are advocating for this access to this expanded service, as dictated by the courts, are saying that there is suffering that could be alleviated if there was access to this. Can you not do both things at once?
But Vassy, if our focus is only going to be on expanding medical assistance in dying and not actually investing on the mental health and treatment piece, we are in fact driving people to make only one choice. I want people to have the option of the treatment. And that's why, again, I will say we've had a 400-bed increase in Ontario alone for mental health beds. We have youth wellness hubs. We now have structured psychotherapy that we have almost 80,000 Ontario residents who have signed up for that. These are programs that were not available in previous years and perhaps might have driven someone to consider MAID if they weren't available. So again, I'm going to say we need to focus and make sure that we have treatment options available to people so that they don't only feel their only option is applying for medical assistance in dying.
And Minister, again, I'll ask, I understand that that's under the province's purview and that should be a focus. But the courts have dictated that this expansion of MAID also be available to someone who suffers from mental illness. There is supposed to be a rigorous process that eventually gets put into place to make sure that the person who applies for it meets the criteria as has been set out. I understand that there's some discussion around how possible that actually is. But as that gets worked out, is it not incumbent on your government to prepare for that eventuality? Because the way I hear you today, it's as though you don't want to at all.
So when I listen to the experts and the clinicians working in the field, when I talk to CAMH, when I hear from the Association of the Chairs of Psychiatry saying that they are not ready and they are not prepared for this MAID expansion, it speaks to me that we need to make a much clear and focused drive towards treatment, not just how do we make sure that medical assistance in dying can be expanded in Canada.
So on the efforts that you're endeavoring when it comes to treatment, some of the statistics I could find are that there are 28,000 kids in Ontario who are on waiting lists for mental health treatment, double the number since you were first elected. I'm not taking away from the investments that you have made, particularly in the last budget, but why are there so many Ontarians still waiting to get access to mental health care? You've been in office now for a number of years.
Yes, we have, and we have made investments. You know, the commitment that we made with our roadmap to wellness, $3.8 billion over the next 10 years, we're starting to see the investments pay off. There is no doubt that more work needs to be done, but I want to work on that, and I want to focus on expanding access and treatment pathways, primarily, of course, for our youth, but also in treatment beds across Ontario. And we'll continue to do that work. And I want to have a federal government that is part of that solution and not just and exclusively talking about how we expand medical assistance in dying.
To be fair, isn't it disingenuous to paint the federal government as just talking about MAID? Again, the court has dictated that they expand the program, and they transferred a whole bunch of new money to the provinces, including Ontario, a parcel of which was specifically for mental health in the last year. Why are you saying that they're solely focused on MAID?
So when we talk about and look back at the conversations that we had in the federal, provincial, territorial meeting in the fall with all the health ministers, including, of course, Minister Holland federally, we were very clear that we wanted more of a focus on treatment and less on expanding MAID. And that is direct feedback that I and our government and other health ministers have heard from clinicians working in the space. If we have mental health experts, mental health physicians, doctors saying that they are not prepared at this time to move forward on medical assistance in dying for mental health individuals, then is it not incumbent on us to make sure that we look at the other pathways and make sure that we're making those investments? And that's why, again, I will say we have made those and will continue to make those in Ontario.
But you have done so with the assistance of the federal government, which has transferred a ton of money, again, some of which was directly parceled for mental health. And yet, the outcomes, you say, are just starting to be realized. Can you quantify what kind of a difference your government has made, even against the backdrop of knowing that the MAID expansion was down the road?
So if we are to compare outcomes, then I want to compare outcomes of the individuals who are accessing those 400 additional mental health beds. I want to compare the outcomes of the young people who are accessing youth wellness hubs, 22 of them across Ontario, who didn't have that pathway to treatment and referrals that we previously had. Structured psychotherapy, where we had 80,000 people. And it's a program that we've literally just begun in the last 2 or 3 years. So seeing some of that investment starting to take hold within our communities gives people who have concerns and have loved ones suffering from mental health options other than, I guess the only thing I need to look at or I can look at is medical assistance in dying. That's not what we need.
Should that investment, though, Minister, with great respect, not have come at an earlier juncture and perhaps with more heft, and you wouldn't have 28,000 kids on a waiting list to access mental health services? Again, double the number who were there when you first came into office.
Well, I will say that as we make those investments and as they come online within our communities, we are seeing the numbers decrease. It's going to take time. This was not something that was a new problem. This is something that has been building up over years. Listen, I've been an MPP for many years and have seen in my own community families struggling to find placements, to find treatment for their loved ones. So this is not a new problem, and we are committed as a government through Premier Ford to make sure that those investments are out in community. And as I say, we are starting to see the numbers decrease because of the investments.
Okay, Minister, I'm out of time. I appreciate your time as always this evening. Thank you.